All right. Well, the healthcare debate, it's getting down to the nitty-gritty, and if you think it's been heated, well, just wait. It could get even hotter. There's a chance the Senate Finance Committee will pass healthcare by midweek. Then it's on to the full debate in both houses after that. So will we see any bipartisan support for a bill that President Obama wants passed by year's end? Is it possible for a fair and balanced debate? We're going to bring in Republican Congresswoman Judy Biggert of Illinois, and soon we're going to bring in a Democratic congressman on the phone. We've got John Yarmouth of Kentucky joins me now on the phone. Thank you very much for talking to us. I'm going to start, ladies first, Congresswoman Biggert. Republicans obviously haven't been on board since the beginning with Obama's health care plan thus far. Any chance we're going to see bipartisan support by year's end?
Well, you know, we were always hopeful, but I think that the other side of the aisle just chose to do it alone and never wanted to work with us. Didn't really come and ask us to be part of it from the beginning. And I think that that really set a bad precedent. I think that, but on the other hand, you know, there really is such a fundamental difference between our side of the aisle and their side of the aisle on this issue. They want to have a systematic change in the whole healthcare system. We think that we can do healthcare reform without changing the whole system, without taking away what 85% of the American people want, and that's to keep the health care plan that they have, and then bring in the other 15%. And I think that we look at making changes just as far as controlling cost, making sure that there is no pre-existing condition to block their health care, portability so that they can change jobs rather than all of the changing it dramatically.
Congressman Yarmouth, you know, it doesn't seem that there is any compromise, at least from Republicans' standpoint. They say Democrats haven't been listening. They haven't been reaching out to them. They haven't been taking any of their ideas into consideration. Whether you believe that or not, what are Democrats going to do between now and January to come up with a compromise if they think they can come up with one on the hotly contested public option? That is the hotly contested public option #1 issue that is obviously not getting anywhere. This bill isn't moving.
Well, actually, the bill is, I think, moving fine in the House. We're going to pass a bill with a very robust public option. It's what 65% of the American people said they wanted in a poll just a week and a half ago. It's a shame that I'm on here with Judy Biggert. Judy and I have worked together on some important pieces of legislation, the education bill. We know what it is to be bipartisan. But in this health care debate, it's pretty clear, and the Republicans have been very explicit about it, that their strategy is to try and kill any health care reform because they know that if we can do what the American people want us to do, which is to provide a sustainable, affordable healthcare system that makes people secure and stable in with their health care issues, that it will not just be a great victory for the American people, but be a great victory for Democrats. They don't want us to have that, so they've chosen to be as obstructionist as possible, and it's a shame, but we really don't have too much in common on this debate. We all say we pay lip service to the idea that we want to ban pre-existing condition rating and so forth. But the truth of the matter is I have yet to hear a Republican, maybe Judy will prove the exception, but I've yet to hear Republicans say that whatever we did on this bill, they would vote for health care reform that we advance in the House. I have not yet heard one Republican say that given certain things, they would vote for it. And that's a shame.
Congresswoman Biggert, would you vote for it?
Okay, well, nice to be with you, John. But I think on this issue, you're right. We don't agree. But you know, I would like to. However, I don't think it's the right bill, and I think that you're going to have a hard time passing this bill. I think it's going to have to. Nancy Pelosi and Harry Reid are going to have to be out there strong-arming some of your members because you've got such a diverse group from the progressives, liberals, to the Blue Dogs, and I think the Blue Dogs are the ones that are going to have problems with this bill. The Blue Dogs are those moderates that are 49 of you are in districts that were won by John McCain, and so it's a different constituency that they have there. And I know we saw this summer it's some of the hard times to go home and meet with their constituents when I don't think a lot of them agree with the bill that's been proposed.
Yeah, I got to say a lot of Democrats are complaining that they don't have Nancy's support. Nancy Pelosi is not necessarily backing them, and they're afraid that when they go to vote, it could backfire come midterm elections. You need you need your leaders to support. I mean, your party. That's
right.
kind of bottom line.
Well, and that's why I think. Julie, that's why I think it will only be passed with, one vote or 2 votes, because they're going to let people off that, that have a constituency that doesn't believe in the issue as proposed.
All right, Congressman Biggert.
They will.
Thank you very much, and Congressman Yarmouth, we appreciate you as well coming on the phone. Thank you both.
Good to be with you.
Thanks.
All right, a Fox News alert. We're just learning now there's